Health, advanced heart failure is something that affects thousands, even in Louisville. Joining me to talk about advanced heart failure and effective treatment options is Dr. Sheng Fu. Thank you so much for coming in, because this is such an important topic for a lot of people to not only prevent it, but also treat it as well. But for those who aren't familiar, what is advanced heart failure?
Yeah, thanks for having me. So advanced heart failure, everyone's heart failure journey looks a little different. And so the way I describe advanced heart failure to a lot of patients is when patients live with heart failure and they just get the feeling that it's not working, the meds aren't working. And we have great medical options for heart failure these days that can give patients plenty of health and life and treat their symptoms. But in a lot of patients, at some point, those meds stop working. They're getting rehospitalized. They're getting these hiccups in the road that they just don't feel very good about. And at that point, we should start a discussion, right? And it really is a discussion, because it's not something for everyone, about advanced heart failure options. And we have two great options available, which is either heart transplant or a mechanical heart pump called a left ventricular assist device, or an LVAD.
Yeah. And kind of backing up, you mentioned how everyone's journey is a little bit different, but what are the leading causes of advanced heart failure?
Yeah, so if you look at statistically, the most common cause of heart failure in this country is either heart attacks or blockages, or long-standing kind of not well-treated high blood pressure. And those two are kind of 1 and 2. But beyond that, there's a variety of different options. Some people can have viruses that attack the heart, or it can be a genetic cause, or it can be something wrong with their heart valves. So there's a lot of different paths that can lead to advanced heart failure, where they just feel like the meds aren't working, they don't feel good, and we can talk about other options.
Yeah, and how many people are actually affected by this?
Oh, it's plenty. It's probably, our best estimates are probably annually somewhere in the 100,000 or so a year in this country. And so it's certainly a real issue.
Yeah, for sure. And so kind of walk us through the process of determining whether a patient is suitable for that heart transplant.
Yeah, the heart transplant process is pretty extensive, I would say, because there's kind of two main questions that we try to answer, and three really. But the first one is your heart sick enough to need a transplant, right?
Yeah.
Like if you may not feel well, but if the heart still looks like it's doing well, there's no better heart than the one that you're born with. And as a heart transplant doctor, like, I openly tell that to patients. There's no better heart than the one that you're born with.
Right.
So first is determining how sick is the heart, and is it something that is transplant appropriate for you? The second question is a bit more complex and nuanced, and is the rest of the body strong enough to endure major surgery like that?
Right.
And so there's a lot of testing that goes into looking at your kidney function, your liver function, your lungs, and basically to get a sense of how strong the rest of the body is, to make sure that it can endure that. And then the third part of that evaluation is to look at what your support is, because everyone's going to need some help to kind of recover after surgery. And so we try to look at, who's around, who can help. Unfortunately, we live in a country where finances is something that we have to consider.
Yeah.
And so there's always going to be those questions that we have to look at.
And so what are the most significant advancements in heart failure treatment or heart transplant surgery in recent years?
Yeah, I would say, so a heart transplant we've been doing since the 60s as a species, I suppose.
Yeah.
The advancements have largely come around with medications to help manage immune suppression, to prevent things like rejection and things like that. If anyone's been following the news, there's been some breakthroughs in terms of looking at, for example, pig hearts. That's still very, very early, and I think it's going to be quite a few years before that kind of becomes mainstream. But the LVAD, that heart pump that I talked about, is something that is a piece of technology. And as we all know, technology improves much quicker. And so that's something that our current generation of heart pumps is much safer and much better than what we were working with even 10 or 15 years ago.
Yeah.
But I would say the biggest breakthroughs in heart failure have been on the medical side before they get to advanced therapies. Like I mentioned earlier, everyone's journey is a little bit different. The medicines to treat heart failure have gotten to the point where everyone's journey is, in general, a bit longer before we have to potentially talk about things like transplant.
Yeah. Well, there's definitely so many different options, and we're thankful that there have been so many advances in technology and in medicine. So we greatly appreciate you coming on and chatting about it. So thank you.
Absolutely. Thank you.
All right. So to learn more, just visit UofLHealth.org.